Hey everyone and welcome. Today we're going to dive into the secret world of germs and really uncover the invisible architecture they use to travel from one person to another. It's kind of like we're cracking open the official rulebook for how infections actually spread.
I mean, really think about it for a second. How does a germ, something totally invisible to the naked eye, manage to journey across a room, then a city, and sometimes the entire globe? It's a fantastic puzzle, and today we're going to put all the pieces together.
So it turns out every single infection has to follow this exact six-step process. We call it the chain of infection. For a germ to actually make someone sick, all six of these links have to connect in order. But for our explainer today, we're going to zero in on one of the most important ones, that fourth link, the mode of transmission. This is the how. This is the actual journey the germ takes.
Okay, so let's get on the same page with a quick definition. Disease transmission is really just the A to B journey of a germ, right? It's moving from its home base, which we call a reservoir, to a new person or a host who can get sick. This is the fundamental idea we're building everything on today.
And here's the cool part. No matter what kind of germ we're talking about, it's always going to take one of two main highways to get where it's going. You've got direct transmission, which is the express lane, and then you've got indirect transmission, which is more like the scenic route that needs a layover.
All right, first up, direct transmission. And yeah, it's pretty much exactly what it sounds like. This is all about immediate person-to-person spread. There's no middleman, no stops along the way. It's the most straightforward path an infection can possibly take.
And you know, the most common way this happens is through simple, direct contact. I mean, it doesn't get more straightforward than this. A germ spreads because of physical touch. We're talking about anything from a handshake to a kiss. If there's skin-to-skin contact, this pathway is wide open.
And you can see just how common this is with these examples. A lot of these diseases, especially things like scabies or ringworm, and of course, STDs, they absolutely rely on this direct physical pathway to find their next home.
So, if the germ's main strategy is touching, what's our best countermove? Well, it's super simple, but honestly, it's a game changer. Good old-fashioned hand hygiene, just washing your hands, is the single most powerful way to break this specific link in the chain.
Okay, next up in the direct category is droplet spread. So when somebody coughs or sneezes, they're launching these little microscopic droplets. And the key thing to remember here is that these guys are kind of heavy. They're too big to just float around, so they fall out of the air pretty quickly, usually within about 1 meter or 3 feet.
And wow, look at this list. This short-range attack is how we get some of the most familiar sicknesses out there. The flu, whooping cough, many common types of pneumonia. They all ride on these short-lived droplets.
And suddenly, all that public health advice makes perfect sense, right? A mask creates a physical barrier to catch the droplets. Coughing into your elbow traps them. And keeping a little distance literally puts you outside of that 3-foot fallout zone. It's all designed to put up a roadblock on this short-distance highway.
All right, now for a route that's a little more intense. Direct inoculation. This is what happens when a germ doesn't just land on your skin, it gets a VIP pass straight past your body's #1 security guard, your skin, and goes directly into your tissues or your bloodstream.
We're talking about things like an animal bite that carries rabies, or a contaminated needle that transmits hepatitis B, or even just a rusty nail that gives you tetanus. You see the pattern. In every one of these, the germ gets to skip the line and is basically injected right into the body.
And for our last type of direct transmission, we have a really unique situation called transplacental or vertical transmission. This is that very special, very direct pathway where an infection can pass from a mother to her fetus during pregnancy.
All right, we've covered the direct routes. Time to switch highways and talk about indirect transmission. These are the sneaky ones, right? The germs that don't need to go person to person. Instead, they use a middleman to do the traveling for them.
First up, we've got airborne transmission. And listen, this is not the same as droplet spread. This is a whole different ballgame. We're talking about particles that are so tiny and lightweight that they don't just fall to the ground. No, they can hang in the air for hours, like a spooky mist, and travel way, way beyond that 3-foot zone.
And that right there, that ability to just float and travel, is what makes these diseases like measles and TB so ridiculously contagious. You don't even have to be close to the person who's sick. You just have to walk into the same room they were in earlier.
All right, next on our indirect tour, vehicle-borne transmission. And no, we're not talking about a Toyota. Here, a vehicle is anything non-living that a germ can hitch a ride on.
Think about things like contaminated food, or water, or even medical tools.
And this route is a huge deal for public health around the world. I mean, an outbreak of cholera from dirty water or food poisoning from a restaurant, that's the vehicle doing the dirty work.
Okay, let's talk about vectors. This is when the middleman is actually a living thing, usually an insect. But there's a really important difference here. Think of a mechanical vector, like a housefly, as just a dirty taxi service. It picks up germs on its feet and just drops them off somewhere else. But a biological vector, like a mosquito, oh, that's way more than a taxi. It's more like a living, breathing factory for the germ. The mosquito ingests the germ multiplies like crazy inside, and then it gets injected into the next person.
And finally, we have something called fomite transmission. Now, fomite sounds super technical, but it's just a fancy word for any object that can carry germs. We're talking doorknobs, your cell phone, a TV remote, you name it. If a sick person touches it, and then you touch it, that object just acted as the bridge for that germ to get to you.
Okay, wow, that was a lot. So let's just quickly pull it all together. We've got our direct routes, like touching and coughing, and then our indirect routes, which use things like the air or food and water or mosquitoes and doorknobs. Each one has its own MO, its own classic example.
All right, so now we know the playbook. We've seen all the sneaky routes germs can take. But knowledge isn't really power until you use it. So the real question is, what do we do with this information? How do we become a chain breaker?
And this right here, this is the most important thing to remember from all of this. You don't have to be perfect. You just have to break one single link in that chain we talked about at the beginning. If you can interrupt the germ's journey at any point, the infection stops cold.
And this is how it all connects. This is where the magic happens. Look at this. All those simple things we do every day line up perfectly with the transmission routes we just talked about. Washing your hands? Boom! You just shut down the direct contact and fomite highways. Wearing a mask? You just put up a roadblock for droplets and airborne germs. Every action is a specific defense against a specific route.
So there you have it. You now understand the secret architecture of infection. You know the highways, the back roads, and the detours that germs are using to get around. So now that you know the rules of the game, which link are you going to break today?